Hello to everyone. My name is Mateos from the University Hospital of Salamanca in Spain, and I would like to share with you the preliminary results of a prospective non-interventional study of a real-life standard of care in patients with relapsed and refractory multiple myeloma with more or 3 prior lines of therapy. This trial is the LocoMMotion study, and the main objective has been to evaluate what standard of care are utilized in relapsed and refractory myeloma patients after 3 or more prior lines of therapy, all of them exposed to proteasome inhibitors, IMiDs, and anti-CD38 monoclonal antibody. The rationale for this study is, in principle, we don't have any standard of care for this population, and we know that the triple refractory population is really an unmet medical need. This is the first prospective non-interventional study conducted in this specific population, and a total of 225 patients were included for the first interim analysis presented at ASCO 2021. The median follow-up time was 4 months, and just to know that these patients, the median age was 68, and the median number of prior lines of therapy was 4, and all patients were triple class exposed, and in principle 74% of them were triple refractory. When we evaluate what rescue therapies these patients received when they were relapsed and refractory to 3 drug classes, important to note that more than 80 different regimes were observed as rescue therapies, indicating that there is not any standard of care for this population. In terms of efficacy, this analysis is an interim analysis. The overall response rate was around 20%, indicating that in principle, this overall response rate is quite short, and safety profile has been also evaluated, and in principle, approximately 40% of the patients presented any grade 3-4 adverse event. The trial is ongoing, so we don't have any data yet in terms of outcome, in terms of progression-free survival, but the initial analysis of these interim results from this first perspective of real-life standard of care treatment in heavily pretreated triple-class exposed patients with relapsed refractory myeloma demonstrates that only about 20% of patients can achieve a response using conventional treatments, indicating that there is not any standard of care for this population, and there is a need for new treatments with a novel mechanism of action. The trial is ongoing, and in the upcoming congresses, we will have the opportunity to show progression-free survival as well as overall survival.